Knee pain happens to all of us at one time or another. As a physical therapist of 25 years now, I've seen a lot of people that have knee pain, and I've heard a lot of reasons for it, all people of all shapes and sizes and different activity levels. But one conversation that keeps coming up is cortisone shots. So a lot of people ask, hey, should I get a cortisone shot for this? Or more often than not, by the time I get to see people, they've already had one and it hasn't worked out very well. So this video, I just want to talk briefly about why the cortisone shots might not be the best answer for your knee pain and what might be a little bit more helpful for you. So here at Berkshire Fitness Company, or BFitCo, we have a kind of an open door policy. So all 50 states have direct access to physical therapy. You don't need a referral in any state anymore to go see a physical therapist. So we opened this space as a place for people to be able to come in, get the answers that they need quickly, as hopefully as the pain is emerging, and maybe not having to wait months before they actually take some action. So knee pain, I saw a lady yesterday and she'd been having knee pain since January, so it's now the end of March. So she's about 3 months into having a sore knee. It's swollen, it's kind of gone up and down as pain, musculoskeletal pain often does. But about 3 weeks ago, she started to have some plantar fasciitis on the other side. So couple of questions she had was, could that foot pain have something to do with my knee pain? And the answer is almost always, yeah, for sure, because we make compensations when something hurts, and we load differently and our feet interact differently with the ground. So if you start out with some knee pain that just won't go away, it's pretty common for another spot of pain to pop up, either maybe in your foot on the other side, maybe in your hip along the outside, up into your low back. Everything's kind of a chain reaction. But in this video, I just want to talk a little bit about cortisone shots. So this particular lady had a cortisone shot, I believe it was 2 months ago, and she said it helped for about 3 days. So that's reason number one why a cortisone shot may not be your best choice for knee pain. It's a very short-term benefit. Studies show that at best, people are getting 3 to 4 weeks of relief, but then the pain comes back if nothing changes in the way that your body's moving, the activities that you're doing. If you're the best friend to the hip, to the knee, is what's right below it and right above it. So your foot and your hip. Which brings me to point number two. A cortisone shot does not address the actual cause of the problem. A cortisone shot goes in and sometimes helps to reduce some of the inflammation, which is a symptom. That's not the cause of your pain. Your knee doesn't just swell up inside because it feels like it. It's getting impact in a way that it doesn't like, and your body is going in and inflaming it to try to protect it. So a cortisone shot is never going to help you find out why that happened in the first place. The third reason is there's an incredible amount of research out there that's showing that a cortisone shot actually degrades the cartilage in your knee. In other words, brings on arthritis even faster. The other thing that they're showing in the studies that these cortisone shots are doing to people is that they're decreasing the bone density. We see people here all the time. We work with a lot of people 50 and over here at BFitCo, and bone density is a big concern. So why are so many doctors still injecting those knees and those shoulders with cortisone without trying to find out and help someone figure out what's causing that problem in the first place? I'm not sure, but that's what we focus on here. So number one, if you want longer term relief from knee pain, we need to figure out what's happening above the knee and what's happening below the knee. And we look at that in all planes of motion, kind of take a look at you moving forward and back, take a look at you moving side to side and with some rotation, and then we can help you figure out what you can do at home to make that knee, give your knee its friends back. That's what we say a lot here. The other thing that is just crucial, I think, for people to understand is this bone density and this cartilage loss from cortisone shots. So flip that around, and how can we what actually increases bone density or keeps it at least from getting worse, and what actually helps the cartilage stay more fluid. What keeps your cartilage healthy is movement and strength. So that's the key. We need to move. We don't need to be getting shots in our knees when they hurt. It's certainly not before someone has taken a look at how you're moving.